Thank you and good morning. I'm Judy Taylor. I'm one of the Cancer Centre managers. This should have been our lead nurse, but unfortunately she's away ill at the moment. I've got with me somewhere Rosemary Horseman and our patient Richard Seddon, if you'd like to make yourselves known.
Hi, everybody.
Hi. Hi, Richard. So our presentation is around a project that we did just before COVID on improving the patient experience on the ward. So could we have the first slide, please? So a team of people were responsible for delivering this project. And we were joined by Richard, one of the patient partners that we have working alongside us in the trust. Just as a bit of context, Leeds delivers services across 7 hospitals and treats 1.5 million patients every year, including more than 200,000 emergency patients. We spend 1.34 billion even, and we employ more than 20,000 staff. And we've got links to the universities and industry. We've got a sort of mentor is that if we can do it in Leeds, you can do it anywhere. We've got a whole raft of problems which we've come together as a trust, and we work with the university and leaders in industry. So there was a team of people helping to deliver this project. I've put some of the team up, but this is by no means all. There were so many people involved with this who freely gave their time on top of their day job. Next slide, please. So we were trying to accomplish what we were trying to accomplish. We did a driver because everybody likes a driver diagram, and our lead cancer nurse and the head of patient experience realised that they had a common goal to improve the experience of our inpatients. The National Cancer Survey showed results that we had room for improvement. And around the same time, our head of patient experience had come across some work done up in Northumbria, where they had improved scores of the patient inpatient section by using real-time feedback. It just didn't feel right making decisions about patient care without the contribution of a patient, particularly as being an example in the trust where that contribution had occurred and been successful. Around the same time, NHS England Quality Improvement had put a call out via the Cancer Alliances for expressions of interest to join the NHS Cancer Improvement Collaborative. Our first reaction was that it was a very tight timescale, and we thought we did not have the time or the capacity to engage in this piece of work. However, we decided it was really important that we try and improve the inpatient experience for cancer patients, so we took up the challenge. We quickly realised that we needed to hone down as to what we were going to try and improve. We had no budget, we had limited capacity, we weren't sure how the staff would engage with us, and we didn't quite know how we were going to achieve it. But we looked at all the different aspects, and we decided that we were going to try and improve the experience of meal times for our patients on Ward 42. And then following that, we thought we'd be able to roll it out to all wards, not just cancer. So how did we do this? Data was collected live on the wards, and inpatients were asked about 12 questions, and the questions covered communication with a range of healthcare professionals, the ward environment, involving in decision making, and trust and confidence in the ward staff. We collected the data fortnightly, and a poster was produced, which we're showing you here, to show the responses. Initially, we had a really fancy laminated poster. Our medical illustration team produced it. They were costly and environmentally poor, as they were just thrown away after 2 weeks. So then we went basic and produced our own paper version, and this is what we're showing you here. We were able to see that the interventions that had been put in place improved outcomes for patients, and that by having a member of staff who had been named as outstanding by their own patients resulted in the ward, including doctors, becoming quite competitive. And that was really interesting. Somebody's already said that we like an SPC Run Chart, so there's one. The data supported that the measures we'd set out for this specific piece of work sorry, I've lost my train of thought there. The specific question related to the outcome measure, we had said that 80% of patients who required help to eat their meals got that help. The process was measured and collected by the ward staff. How often a mealtime champion was identified and allocated, how often did the mealtime champion fulfil their roles. Balancing measures were being collected from the staff by the team collecting the patient data. All staff were asked about whether they felt the mealtime champion role had had an impact on patients and also what the impact was having on their role. And I'm going to hand over to Rosie now. Are you there, Rosie?
I am, yes. Thank you. The slides went a little bit mad there, didn't they? Next slide, please. As Judy has outlined, we used a PDSA cycle, and this slide describes what we did. So we reintroduced protected meal times, and we also looked to embed the role of mealtime champion, which you've briefly seen a picture of. Each day, a member of staff was allocated to help with meals, and the focus was on patients not having their meal times interrupted by treatment and people coming onto the wards. This was in response to you saw the posters briefly. One of the things that kept cropping up over and over again were that people were saying that they weren't getting enough help at meal times, and that had also come out of the National Inpatient Survey. Next slide, please. So, as Judy's described, one of the things that we found really positive in embedding the work on the ward was the poster, which initially was laminated, but after a while we just printed it out on the office printer. But one of the nice things about that was that one of the 12 questions that we asked the patients was, is there anybody on the ward who has made a positive difference to your experience? And so the nursing staff were seeing their names up there, and obviously they got a really positive benefit from that. And those posters were put together by the patient experience team. And I remember on one occasion telephoning the ward because I was wanting to check the spelling of a healthcare assistant's name that had come up. And I was actually speaking to that healthcare assistant, so I congratulated her, and I could hear the pure joy in her voice. And the other photograph on the slide is the mealtime champion badge, which was worn by staff so that they could be identified by patients and also by the facility staff who are giving out meals. Next slide, please. So the way that we selected patients to take part in the data collection was that it was anyone who was awake and well enough and able to understand. Unfortunately, we also had to restrict it to people who could communicate in English because, as I've already said, we didn't, as Judy's already said, we didn't have a budget, so we couldn't use interpreters. So that's something to think about going forward. Next slide, please. Richard.
Hi, everybody. I've been a patient on Ward 42 and wanted to share my experiences. I was invited by the team to come along and talk to the Trust Cancer Board. And as a result of that, I was invited to join this project. It's been really great for me because I've been able to bring my own ideas and bring the patient perspective, which is really key for the staff to understand what we're thinking. I think I've been valued and I've been considered part of the team and listened to. The communication back to me has been fantastic, and I would encourage any patient to try and get involved. It's easy to sit here and moan and not actually do anything and just use social media to vent your frustration instead of just getting in there and helping. That's what's just fantastic about all of this. And this is just a small project, and this could be used across anything, across all the NHS and any trust. So that's me.
Thank you, Richard. So the next The next steps are scale and spread. We're going to continue to work with 42. Obviously, it all got put on a hold last year because we couldn't go near a ward, but we're hoping to sort of start this off again at the back end of this year into next year. And the part of the ward matrices now. Communicate it out to everybody. It's so important that you've got somebody. We had our trust lead nurse as our executive sponsor for this, so that it was recognised at a really high level. Top tips: start small. We thought we could change the world. We narrowed it down and went deep. Share it widely. Think outside the box. Implement changes that are measurable and can be maintained. And create confidence with your clinical teams. Don't go in with your clipboard. Build a relationship with them. Any questions? Thank you for listening.